Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Matt Ross, a New York theater publicist and producer who is working with a team of people to figure out how and when we can safely go back to the theater. They're developing guidelines for COVID-shuttered theaters around the country and trying to find creative ways to get people back to work. Let's listen.
Matt Ross, thanks so much for joining me.
Thanks for having me.
So I want to talk to you about the work you've been doing. I understand that you are part of an effort to find a way to reopen theater from the regional theater all the way up to Broadway. Talk to me about these efforts and why they're so important.
Yeah, absolutely. And I should preface by saying I think there are a lot of people working. I know that there are a lot of people who are working on these efforts at every level. So, when I founded this group, which we call the COVID Theater Think Tank, it was with a couple of specific things in mind. One of which is to draw from many different types and levels of theater, as you mentioned, theaters across the country, small spaces, off-Broadway, Broadway, and try and find the sort of commonality between them that could then lead to adaptable guidance that different theaters could use as tools towards reopening. And then the other is to draw from all sorts of different disciplines. So we started out as a group of 12, started working at the beginning of April. And we've now grown to over 40, and our group has stage managers and technical directors and general managers, company managers, directors, all kinds of different professions, producers, actors, musicians. But the criteria was the people who spend their lives living and working in and around a theater. Because I thought they would, obviously none of us bring the scientific knowledge to it or the medical knowledge. That's what we have to seek out. But what we do know is how things move inside a theater. So what are some of the challenges that would be presented and how might we solve them? So that was sort of the thesis behind how we organized. And then we've been really fortunate to have terrific advisors. We work closely with the CUNY Graduate School of Public Health and their dean and several of their professors over there, epidemiologists and industrial hygienists and people who've helped us a lot. We've had terrific guest advisors and special advisors on a number of different topics, from testing to ventilation. And, we're digging into all pieces of this to try and interpret the science for the field. Our group as an entity isn't going to make decisions or prescribe the exact solution for every theater. That's not our role. We're basically a research group that can try and interpret this so that hundreds of theaters and productions across the country don't all have to start from scratch in trying to make sense of the science, which, as we all know, is developing and changing rapidly. So that's what we're trying to do.
It's a terrific goal. I mean, I know that Broadway went dark very early. A lot of small theater companies. I mean, there's really no theater happening right now. And I guess the question I have at the moment is, will anyone feel safe in a crowded theater again? And I guess the idea is, how do we make people feel safe?
Yeah, it's a huge question, and it's one of the most important. And a lot of these terrific advisors who I just mentioned have really highlighted to us the importance of communications in public health and in talking to an audience and showing our work, in demonstrating that we're going to investigate these things and we're going to find a way to mitigate risk to such a degree that that hopefully this isn't felt to be a high risk activity. I'll also say I understand that feeling, and I also know that gyms have reopened in New York City and indoor dining has reopened to 25%. And I think everyone has their own opinions on it. But I think as humans, sometimes we think of whatever we're feeling in the moment as definitive. We're going to feel that way forever, and we've felt that way forever. And that tends to not be true. Feelings evolve and change, and something that you maybe couldn't have imagined suddenly feels normal. So there is going to be a degree of normalizing, I suspect, with how we live with this going forward and the steps that we take to make sure everyone is safe. Certainly seems like mask wearing is going to be a part of our culture, if not a full-time part of our culture, perhaps in times of seasonal illness or for high-risk populations or in particularly dense spaces. So there is a normalization part of this. Of course, we have to tackle it and really, crush the rate of infection first and make it safer for people to go out. So I do think that I think we can put measures in place that, I like to sometimes say, how do we get to the level of being no more dangerous than going to the supermarket or taking a walk or something like that? What is that sort of baseline? How do we get to that place? And we understand the factors against it, people sitting side by side in an enclosed room for a longer period of time. So I think they go hand in hand. We have to actually put responsible, ethical, appropriate risk mitigation measures in place. And we have to also demonstrate and communicate well about how we're doing it so that audiences can tell us when they're ready to come back. And not just audiences, I should mention everyone who works in the theater, cast, crew, company, ushers, box office, managers. These are people who also need to be made to feel safe coming back to work. And we owe a lot to them, frankly, because this is an industry that's 90+% unemployed right now. And so, of course, wants to get back to work, but we have to create circumstances that are ethically appropriate for them to return to work.
Mm-hmm. I was thinking about that myself as you were talking. I have a very close friend who is one of these unemployed actors, and she's not sure, how she's going to pay her rent going forward. Is that something you're hearing a lot about from people?
Absolutely. I mean, it's a really devastating time for the industry. We don't have an enormous safety net. A number of theater workers are sort of gig workers to start out with, or independent contractors, or, and because we don't have a defined endpoint, because how could we? We're also, it's hard to say, well, hang on, because there's no way of saying, when are you hanging on until? So it's completely understandable that people might seek other employment or make different life choices. And I think it's really sad. And it's also, I think, a real problem looking at some of the other things that are sort of have been plaguing our society for a long time, but maybe are coming to light now, is that it can create a more unequal industry, in that the people who can stick around are the people who can afford to, that they might have wealth from family or from other sources, or they just have a certain degree of financial independence. And that's a really sad and scary thing. And unfortunately, we don't have the government safety net that I think is merited in this moment, especially as an industry that has a really significant impact. And, you have to think beyond New York and Broadway on the economy nationally as a driver of spending in cities and towns across the country. It hasn't received the sort of commensurate support from the government as other industries that occupy similar places.
It's hard to believe that there isn't theater right now. And it must be such a strange feeling for you right now as a publicist and producer who spent his life doing this.
Yeah, I mean, it's completely bizarre. I mean, I'm used to going to the theater multiple nights a week and seeing shows and working on shows and being in rehearsal rooms. I will say there is, I think one thing that's exciting is there is theater going on, maybe by a different definition. People are starting to use this moment. As soon as the shutdown happened, people really jumped in and said, okay, what can we do virtually? What can we do on Zoom with readings? And have done a lot of that, done a lot of concerts, some really great stuff. And I think are now starting to expand and say, well, how can we expand the definition of theater to something we can do virtually? And there's absolutely a communal nature to it. But I've also attended pieces that where you actually do feel like you're amongst people, even though you're sitting in your living room and staring at a screen, and can find ways to do that. So I think that's a really exciting thing that can come out of this. It also can make theater it can open up a wider audience for theater where it becomes less geographically specific. There are theaters in New York. I work with, amazing off-Broadway theaters in New York who produce tremendous theater. Some of our best theater is by playwrights who are working off-Broadway. And if you look at like Pulitzer winners and other really acclaimed plays, a lot of them have a 6 to 10 week run in a 200 or 300 seat house off Broadway. And that means we're limited in who actually gets to see and hear some of the most exciting voices. So I think there is potential that we can go wider. The challenge of it is we need to employ people, and that, to build that. Partially answers a question of keeping the flame of the art form alive. But, and artists are getting compensated for this work by a lot of theaters. But, not in the kinds of numbers and the kinds of ways, nor does it create a fiscal model for a lot of these nonprofit theaters who are leading the way on this. So there's hope there too, but still a ton to solve.
So what kind of work are you doing in terms of creating maybe guidance for theaters to open? I know you were talking to me a little earlier about time and motion studies. Talk to me a little bit about some of the things that you think might help propel us forward a little.
Sure. We have a number of areas that we're really focusing on. And in fact, I'll say the first few months, we're probably just focused on trying to wrap our heads around all of the information and trying to figure out how to put one foot in front of the other.
For everybody was feeling that way at first.
Yeah. Exactly. Yeah. And we got a lot of great guidance from a lot of really smart public health minds on that too. So some of the areas that we've landed on now, as you mentioned, a time and motion study, which basically is a way of analyzing movement through a building. Or so what does a theater look like backstage, for example, and in the front of house where the audience is loading in, everywhere from 90 minutes before the show to 30 minutes after the show? What are those traffic patterns? How do people move? What are areas of potential exposure? What are areas where there's maybe too much congestion? Does it identify a corridor backstage that needs like an extra sort of wipe down during the show, or some kind of ventilation measure to make sure that fresh air is flowing through that? So that's one area that we're studying. We're looking, really closely at testing. Certainly in this moment, well, first of all, I'll say, I think we need to be solving both for the eventual, how do we fully return with the appropriate risk mitigation, but also how can we scale up? We can't just turn on the lights on all of theater in whatever amount of time that is. So how do we also start doing smaller things? And some people have started to do things outdoors in smaller numbers with social distancing. What can we do in the meantime? And I think one thing that's important maybe to both of those is testing. How can we have testing in place for companies and for people who, if we're having actors on stage without masks and musicians and crew members, then we really need to have systems where we have high throughput, highly reliable and sensitive and pretty fast testing. I'm not going to say necessarily rapid testing because that's sort of taken its own definition. So it's not necessarily 30 minutes, but how can you test people frequently enough and have a testing cadence that will really, create appropriate safety for the people on stage who you're putting at higher risk by having them singing, speaking, maskless, interacting closely. And of course, only having that when necessary, right? You'd have a mask on backstage and whenever you don't need to be on stage. So testing is a big area. And we also have to look and see, does audience screening make sense? And that depends on a lot of things. It depends on, when we get to herd immunity or when the rate of infection slows. We don't have a lot of information on what happens if you get the right ventilation and HVAC changes made to your system, and you have mask wearing and you have hygiene measures and touch-free fixtures and all of that sort of stuff. We still don't know how much that mitigates risk for people who are sitting in a room for an hour, 2 hours, any significant amount of time. So that information may come through. In the meantime, we may need to look at potential audience screening. I don't think we have today. I'm sitting here at the end of September. I don't think we have high enough throughput testing to achieve that right now, but it certainly seems to be on the horizon. I mean, the testing progress that's been made over the past 6 months is remarkable. And we've had the good fortune to speak to a lot of the labs and people developing tests and some of the stuff that's coming forward. And I think there is a lot there that is promising. So that's another area that we're looking at. And then, as I mentioned, ventilation and air filtration. So working both, I think what we've learned, and it's taken time, and I need to mention that everyone on our think tank, we are not medical professionals. We are not doctors. We're not scientists. We're taking it from the theater angle and trying to lean on our advisors for that. And what we're learning, or where I think we are today, is that we need to address both the scientific side of air filtration and ventilation, and that can lead to things like you should have this many air changes per hour. You need to have this level of filtration or filtration to remove particles of this size. or this carbon dioxide concentration, but that's only one half of the puzzle. The other half of the puzzle is the engineering, and actually a good protocol to make sure that you're maintaining whatever equipment you put in place. So now we have sort of parallel conversations going with both of those fields, and are trying to come up with some guidance, and again, adaptable guidance, because every theater is different.
And my last question is, any time frame for when we might be back there in the dark listening to people sing?
So that's actually the one question that we generally keep off limits in our group, because we don't fully control it. There are a lot of other factors, but what I'll say is this: is that I think we can start to do things. We can look at other things that are opening up. We can look at sort of macro data of what is happening when, if you look at New York City, and I'm going to take an unscientific point of view here, but we had rallies and protests in the city really all summer long with enormous amounts of people. Mask wearing was really quite vigilant, and I say it both from the footage and photography and having been at a few of them. It was incredibly impressive. And these were outdoors. And unless I missed something in the data, we didn't see so much as a bump in New York City. So that tells us something from a macro perspective. Outdoors and mask wearing seems to work to a degree. So what can we start scaling up? I think we have to do this like everything else. Are there spaces in which we can social distance a bit? Are there more outdoor spaces? Are there people who are going to get really creative? I've started to see some creative things pop up with plexi. I drove by in New York the other day, a restaurant that was doing outdoor dining in actual bubbles. So just getting literal with the bubble system. Can we do development work also at the same time? So I think we're going to get there. And I think our field thrives on creativity and innovation. And I think I see our responsibility as like, how can we help provide the logistical and the science side to let that lead so that we can have activity?
Matt Ross, thank you so much for joining me.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.